Hello everyone, this is Aiden, and today we're gonna look into lung cancer. Lung cancer is the uncontrolled growth of abnormal cells in one or both lungs. These abnormal cells do not carry out the functions of normal lung cells and do not develop into healthy lung tissue. As they grow, the abnormal cells can form tumors and interfere with the functioning of the lung, which provides oxygen to the body in the blood. So, as we all know, that smoking is a top leading cause of lung cancer. But why is that? Smoking causes lung cancer by damaging the cells that line the lungs. When you inhale cigarette smoke, which is full of cancer-causing substance, changes in the lung tissue begin almost immediately. At first, your body might be able to repair this damage, but with each repeated exposure, normal cells that line your lungs are increasingly damaged. Over time, the damage causes cells to act abnormally and eventually cancer might develop. There are two types of lung cancer. Small cell lung cancer is almost exclusively in heavy smokers and is less common than non-small cell lung cancer. Non-small cell lung cancer is an umbrella term for several types of lung cancers that behave in a similar way. There are three subtypes of non-small cell lung cancers. Type 1 is called adenocarcinoma. This accounts for 40% of lung cancer causes. It is usually found in the outer parts of the lung. It tends to grow slower than the other two subtypes, so there is a better chance of a tumor being found before it has spread. Type 2 is called squamous cell carcinoma. This accounts for about 25 to 30% of lung cancers. It grows from the cells that line in the inside of the lung's airway. Squamous cell carcinoma is usually found at the center of the lung. Type 3 is called large cell carcinoma. This accounts for 10 to 15% of lung cancers. It can be found in any part of the lung and tends to grow faster than the other subtypes. And now, let's talk about some of the major complications that lung cancer causes for patients' daily life. Shortness of breath. People with lung cancer can experience shortness of breath if cancer grows to block the major airways. Lung cancer can also cause fluid to accumulate around the lungs, making it harder for affected lung to expand fully when you inhale. Number two, coughing up blood. Lung cancer can cause bleeding in the airway, which can cause you to cough up blood. Sometimes bleeding can become severe. Treatments are available to control bleeding. Number three, pain. Advanced lung cancer that spreads to the lining of a lung or to another area of the body, such as bone, can cause pain. Here are some other risk factors for lung cancer: exposure to secondhand smoke, exposure to random gas, exposure to asbestos and other carcinogens. And most importantly, if one of your family members had it, there is a chance that it could be hereditary. And let's take a look at the stages of non-small cell lung cancer and small cell lung cancer. Here are the stages for non-small cell lung cancer. Stage 1 is when the tumor is in a single lung and has not spread to any lymph nodes or distant organs. Stage 2 means that cancer has spread to the lymph nodes inside the lung but has not spread to any distinct organs. Stage 3 is diagnosed when cancer has spread to lymph nodes at the center of the chest but has not spread to any distant organ. In stage 3A, cancer has not spread to the opposite side of the body. Stage 3B, it has spread to lymph nodes in the opposite lung and has progressed above the collarbone to the throat and the neck. In stage 4, it's diagnosed when cancer has spread throughout the body. Small cell lung cancer accounts for about 15% of all lung cancer causes. We can break the disease down into two categories: Limited stage, when there is cancer only on one side of the chest. Extensive stage, when cancer has spread to the opposite side of the body. To determine what kind of treatment to use, the doctors often look at 1. The type of cancer the patient has. 2. The patient's age and overall health. 3. The stage the lung cancer is at, whether it has spread to the other parts of the body or not. As one of the most common lung cancer treatment, there are usually four types of surgeries: pneumonectomy, lobectomy, segmentectomy, and laser surgery. Chemotherapy is medicine that fights cancer. Some kinds of chemotherapy come in pills. Other kinds are delivered into your bloodstream by intravenous drip, where a machine slowly drips medicine into tubes that go into your veins. Some chemotherapy is given by injection. Radiation therapy uses high energy radiation to kill cancer cells. The radiation can be delivered by a machine that directs the high energy rays towards the cancer, or by a small radioactive pilot that gets implanted in or near the tumor. The goal of lung cancer treatment is different for different patients. For patients who have a chance of a cure, doctors offer curative treatments. Curative treatments are any treatments whose goal is to cure the cancer, to make it disappear. Even if doctors can't cure a person's lung cancer, they can give treatments to help him or her feel more comfortable. These are called palliative treatments. Palliative treatments are any treatments that try to improve a person's symptoms. They do not try to cure the lung cancer, but they do try to keep it at bay. Here's the exercise guideline for cancer patients. Aerobic exercise. Symptoms limited, moderate intensity. Exercise at least every other day, 15 to 40 minutes. For strength exercise, 50% of one repetition maximum. 2 to 3 days a week for 20 to 30 minutes. 2 to 3 sets for 3 to 5 repetitions, building to 10 to 12 repetitions. For flexibility training, it's 5 to 7 days a week. Purpose is to increase and maintain range of motion, decrease stiffness. Last one, functional training. We want to maintain as much independence as possible. So we suggest that the patient can perform it daily and see a progress as it goes. And for the final part, exercise is definitely beneficial for improving the quality of life and disease prevention. And that is it for my video today. Thank you guys so much for watching and hope you have a great day.